Arizona has put a pause on new applications for a key child care subsidy. The reason? A drop-off in federal child care funds is resulting in some daycare centers emptying out, leaving parents with fewer daycare options. We learn more from Kristen Pollitt, Director of Early Learning and Education at the Children's Action Alliance. Kirsten, thank you so much for joining us on Arizona Horizon. Good to have you here. Let's define terms. This child care subsidy cliff, what are we talking about here?
Yes, and thank you for having me here today. So first and foremost, childcare is just not affordable for families. When we're talking about what this expense means, infant-based care right now is upwards of $14,000 to $15,000 a year. And when we talk about the rising cost of housing and utilities and groceries, it's one of those areas that families are just not able to afford it, but it's one of those, double-edged swords where they need to afford childcare because they need to go to work, and they need to be able to go to work to afford childcare. So when we talk about the childcare subsidy cliff, essentially what that means is that there were federal funds during the pandemic that really were meant to help alleviate some of the underinvestment that we've had, decades of underinvestment in the childcare sector. So we received the American Rescue Plan Act, or ARPA. We received the nation $39 billion, $24 billion of that was to sustain childcare operations, and then the $15 billion of that was to make childcare more affordable for families. And that money ran out last year, and that's where we're kind of in this cliff right now.
So we're at the cliff because the federal money simply wasn't replaced in any way, shape, or form, at least not yet. And now there's a waiting list to get on to, what was it, a subsidy program? Talk to us about that.
Yes, so the Department of Economic Security has the Child Care Assistance Program, and that is where low-income families are able to receive government assistance in order to offset some of the child care costs that I mentioned earlier, with $14,000 to $15,000 at times for infant-based care. So the waiting list is statutorily required for the Department of Economic Security when the demand for child care subsidies is higher than the amount of state funding that is available.
How much state funding is available? I mean, is it even close?
So last year, we did ask for $100 million, knowing in anticipation of running out of the federal funds. So we went in with the $100 million ask. It was in the governor's budget, and when it came down to budget negotiations, and what we got was $12 million. So, which we were thrilled about, because that was the first appropriation that we got for child care in over a decade. So, but that was not enough, because we went in with a $100 million ask. There was only $12 million appropriated, which is why DES did re-implement the wait list.
And the wait list is for new applicants only, correct?
Yes, so it's for families that are currently not receiving the child care subsidy. But when we talk about the families that even qualify for this, they have to be 165% or less of the federal poverty line. So we're talking about a single mother with one child making less than $35,000 a year.
All right. This has to be affecting daycares around the valley. I would imagine, especially in let's just go this direction. In lower income areas of the valley, what's happening there because of this?
There's a lot of things that have been happening. I mean, when we talk about those that do qualify for the child care subsidies, it's those that are in more lower income communities. And what is happening is a lot of child care providers are not able to sustain operations to the full extent. They are getting calls of, needing from parents and families needing child care, but they don't have the money to do so because they are on the waiting list right now for the DS subsidies.
Yes.
In addition to that, there's also, a reduction of Quality First scholarships that also helps alleviate some of those costs, but those have also been reduced because of First Things First revenue has decreased as well.
So how is all of this being addressed right now by the governor, by the legislature?
So right now, the governor has in her executive budget proposal $112 million ask. That is ongoing for the state general fund, but that's only expected to alleviate half of the waiting list. So the waiting list, DES does on their website update it every single Friday, and they're anticipated to get caught up with the backlog by the end of this month, but it's upwards of almost 2,000 families and 3,000 kiddos. So it's only expected to alleviate half of that. But like I said last year, she also had $100 million in the budget, and this year it's $112 million. So we really do need that $112 million because we need those kiddos off the wait list.
Kirsten Pollitt, again, early learning and education. Interesting topic, interesting discussion, and let's see what happens this go around with those budget negotiations. Good to have you here.
Thank you so much for having me.